Good afternoon, everybody. My name is Andrea Coomber. I'm the Chief Executive of the Howard League for Penal Reform, and it's my great pleasure to be your chair this afternoon's event. Thank you for joining us for a spotlight focused on safety in the estate. When people are held by the state on remand or sentenced, the very least we should expect of the state is for them to be kept safely. And each quarter, the government releases its official figures on safety. And as a staff team, we analyse them, speak to journalists, discuss what they mean. And today's event is effectively us inviting you into that discussion. And I hope that you'll get involved by leaving comments in the chat box and putting questions into the Q&A box at the bottom of your screen. Today, I'm joined by our campaigns director, Andrew Nielsen, who'll talk about the stats. And because behind every number is a person, our membership officer, Tim Kerr, who focuses on prison members, will share his reflections based on what members in prison tell us. I know that for a good number of people in the audience today, they have, like Tim, spent time in prison. And for you, this discussion of safety can bring back fear, distress, pain. Similarly, we have family members of people in prison for whom this is personal, and people who do or have previously worked in closed settings. Obviously, safety matters because prisons are places where the state has total control of people's lives. When someone's sent to prison, they're sent there as punishment, not for punishment, and their safety and well-being should be assured. I visit prisons a lot, and I know from speaking to prison governors, to staff, and to prisoners themselves that safety is always front of mind. I've lost count of the number of people who've written to me from prison saying that they do not feel safe due to drugs and drones, people serving IPP sentences who share their despair at the endlessness of the sentence, and people convicted of sexual offences who talk about feeling too scared to leave their cells. The stats we're going to share today are shocking, and every one of them represents a person in a system at breaking point. So to introduce those stats, I'll pass over to Andrew.
As Andrea just said, this is a slightly unusual Spotlights event in that we are trying to offer some immediate response to statistics that just came out this morning. Every 3 months, the Ministry of Justice publishes a quarterly bulletin on safety in custody, and that's what we're going to look at today. It covers deaths in custody, it covers self-harm, it covers assaults, and then there's also a separate publication on safety in the children and young people estate, and I'll cover the findings in that too briefly. I want to start by kind of just emphasizing a little bit of what Andrea was just saying. These are only statistics, and statistics can only tell you so much. Last week, a child died in custody, the first child to die in custody since 2019. Now, there's some contention around the circumstances of that death, and I'm not going to speculate on it. But for the boy in question in Feltham, whatever exactly occurred, one way or another, custody did not prove safe for him. And sadly, custody can never be 100% safe. It is one reason we should be careful in the use of imprisonment. Prisons are by their very nature dangerous places. But these statistics, while they can't tell us the human stories of what happens in custody, what they can give us a sense of is a sense of how dangerous prisons are at a snapshot in time, and how well or not the authorities are doing in mitigating the risks of custody. And sadly, for well over a decade now, I think prisons have been particularly struggling with this issue of safety. The pressures faced by an overcrowded and under-resourced adult prison system in particular can be discerned in these regular statistics, which come out, as I say, every 3 months. So what do the latest figures tell us? The bulletin covers the 3 months up to the end of December 2025, but also contains annual details on assaults and self-harm in custody. Just to give some context, I want to say something about the prison population in this quarter. It's important to say that the backdrop in adult prisons at the time was a population that was still pretty high. The Sentencing Act was not yet law, and indeed it's only in recent weeks that we've seen some of the measures from that legislation start to have an impact on prison numbers. To give you a sense of the prison population pressures back in the autumn, I'll take the month of October at the beginning of the quarter because numbers did fall a little, particularly as we got closer and closer to Christmas, which is something that happens every year. In October, the monthly population was recorded in England and Wales as 87,413. Available certified normal accommodation was 81,613. So the system was holding 5,800 people more than it was designed to hold. And that's what we mean by overcrowding. It is still not as high as the government inherited. In September 2024, we had a record high of 88,521, but it's quite a bit higher than the prison population this week. So at the beginning of this week, the population was 85,704. So it was still high. It wasn't as high as the record population that the government saw early in it coming into power. But it was higher than it is right now. So to go into the actual statistics, I'll just say something about the top line picture that the statistics kind of give us, and then I'll go into detail. So the top line picture is that there have been some welcome falls in the overall numbers of deaths in custody, and in particular self-inflicted deaths. But that's against a backdrop, however, of what was a record peak in deaths in custody in the calendar year of 2025. In other words, we were hoping there was only one direction that these figures could go, and that direction would be down. There's also been a welcome fall in self-harm incidents, although rates are still unacceptably high, and there has been a drop in the rate of assaults on staff. Much less positively, however, rates of serious assaults are increasing, 11%, so more than 1 in 10 of assaults involving prisoners on prisoners are serious assaults. And there's been also an extremely concerning spike in homicides behind bars, murder. So I'll cover deaths in custody first in a bit more detail, then self-harm, then assaults. So on deaths in custody in the 12 months to the period ending March 2026, 352 people died in prison, and that was a 12% decrease on the previous month, 12 months. 202 people died due to natural causes, and that was an 18% decrease on the previous 12 months. And 67 people died by apparent suicide, a 28% decrease. But as I say, this is against the backdrop of record highs in all these deaths during 2025. I think most shockingly of all, however, there were 9 homicides in the 12 months to March 2026, and that was an increase from 6 and a new peak in the time series. I think we can go to the next slide. I think that's on this particular topic. And yeah, I mean, for comparison, in the 6 years prior to this period, there were usually between 1 to 3 homicides a year. So to see an increase to 6 and then to 9 in the last 12 months shows just how serious this particular issue has become. 74 deaths were recorded as other. That is an increase from 54 in the previous 12 months, and 43 of these are awaiting further information prior to being classified. It's unclear what that might be about. One of the potential issues is that these are deaths related to drugs in custody, where the immediate cause isn't immediately apparent to the authorities. If we can go to the next slide, I'll talk about self-harm. So in the 12 months to December 2025, there were 72,753 reported incidents of self-harm. That was a decrease of 8%, and the rate of self-harm also decreased by the same amount. The number of individuals who self-harmed decreased by 3.5%, and the proportion of individuals self-harming decreased by 3.6%. The number of incidents of self-harm per self-harming individual also decreased, and the number of self-harm incidents requiring hospital treatment decreased by 13%. The rate of self-harm in the female estate, though, is over 9 times higher than the male estate. And the number of incidents per individual who self-harmed in female establishments was almost 4 times higher. The proportion of women self-harming actually increased by 4%, but the number of incidents per individual decreased. Just to say a little bit more about who is self-harming. In the prison state overall, the rate of self-harm was higher for people on remand than for sentenced people. And then when you look at self-harm broken down by gender, and we might talk a bit more about that later, self-harm in the male estate was higher among men who had been sentenced, but in the female estate, it was higher among women who were on remand, so who have not been convicted or sentenced. We actually are doing work as part of a collective of organisations on the issue of women in remand, and these figures kind of underline really why we're doing that work. Because if you are a woman on remand in particular, it's clearly dangerous and you are more likely to self-harm. And then within the sentenced prison population across the estate, the rate of self-harm was higher for people serving an imprisonment for a public protection, IPP sentence, which Andrea alluded to earlier. And I think that does say something about the worsening situation for people who are still languishing in custody on IPP. But also, and I think this is concerning, the rate of self-harm was higher for recalled prisoners. And I think that's worrying because we think that we will continue to see a high number of people being recalled to custody. And so not good to see that amongst that particular part of the population, there is also at the moment a propensity to self-harm. I want to move on to assault. So if we could change the slide. Sorry, I'm just going to have a sip of water. So in the 12 months to December 2025, assault incidents increased by 2.8%, and the rate of assaults increased by 2.7%. The number of incidents in male establishments increased by 1.9%, and the rate increased by 1.7%. There was a worsening situation in the female estate. The number of incidents increased by 16%, and the rate increased by 19%. And the rate and number of assaults in the female estate are now at their highest level in the recorded series that this particular series of bulletins records. The rate of assaults was 92% higher in female establishments than male establishments. There was an increase of 6% on prisoner assaults, but a decrease on assaults in staff. About 1 in 3 of all assaults were assaults on staff. The proportion of assaults that were on staff remained higher in women's prisons, 48%, than in male prisons. So that just underlines again what seems to be a worsening situation in the female estate. In male establishments, prisoner assaults increased by 5%, and assaults on staff increased by 5%. In female establishments, prisoner assaults increased by 23%, and assaults on staff increased by 26%, both to a new peak. And then on serious assaults, in the 12 months to December 2025, there were almost 3,500 serious assaults. That's a 2.9% increase. The rate of serious assault was higher again in female establishments than male establishments and had reached a new peak. There was a 6% increase on serious prisoner assaults. And the rate of serious prisoner assaults in the female estate again increased quite dramatically, 28%, compared to a 6% increase in the male estate. And this is the first calendar year where the rate of serious prisoner assaults has been higher in the female estate than on the male. There were 908 serious assaults on staff, which is actually a decrease of 6%. So that's the kind of overall safety and custody statistics. I mentioned that there was also a bulletin on safety in the children and young people's estate. I'm conscious I've vomited a whole blizzard of statistics at you here. I'm going to say a few more just to pick up some of the key themes from the Children and Young People's Bulletin. So to briefly run through what that says, it found that the rate of assault incidents per 100 children and young people had increased by 6% on the same period last year. The rate of assault incidents on staff had increased by 10% on the same period last year. The number of unique children and young people involved in assault incidents had decreased by 15% compared to the same period last year. So this suggests the number of children involved in assaults is decreasing, but for those who are involved in assaults, the violence is more intensive. And even more shocking are the self-harm figures for the children's estate. The rate of self-harm increased by 32% on the same period last year, while the number of children self-harming decreased by 6% from 83 children to 78. So again, where self-harm is occurring, it's a smaller number of actual children, but it's much more intensive. We know this is partly driven by the small, I have to say, thankfully, small number of girls in custody. We know that because girls are sadly 11 times more likely to self-harm in custody than boys. Ultimately, what these figures are telling us is that despite not facing the overcrowding and resourcing pressures of the adult prison estate, the children's secure estate is still in an extremely powerless position. And I have to say, it really questions the wisdom of why we are placing children in YOIs like Feltham or Wetherby. I want to close though by coming back to the adult prison estate, because that is the main focus of the statistics that I've talked you through, and try and venture some interpretation of the quarterly figures we've seen today. I don't think it's clear right now why the trends in the female estate in particular are going the way that they are. But talking more generally about the estate, as I said at the beginning, in the quarter in question, October to December 2025, the prison population had seen some reduction on the record highs of the capacity crisis that the government was facing, but it was still under a lot of pressure that dropped a little as the system approached Christmas. And it seems that a modest stabilization in the prison population has maybe allowed the system, particularly in the men's prisons, to focus on reducing some of the most concerning trends in previous safety statistics. So 2025 did see the highest level of deaths in custody on record and a high number of self-inflicted deaths. That trend was already happening towards the end of 2024. And it seems from these stats that some progress on addressing this has been made. And there has also, alongside that, some progress has been made in reducing self-harm. How much that's actually about the actions of staff and managers in the system, or how much it's actually simply a result of people's distress stabilizing as the system itself has stabilized, as the population has stabilized, I think is unclear. And the picture on violence, though, is clearly a lot more mixed. The rise in serious assaults, and especially of homicides in custody, is extremely concerning. I don't want to speculate too much on this, other than to say that I think it emphasizes how fragile the situation in prisons remain. As long as prison numbers continue to drop, as they currently are, I think that hopefully gives those working in the system a chance to right things. But if the prison population was to increase again, and projections on future prison population figures suggest that it will increase again in the medium to longer term, then I think we could see things reverse quite quickly and get much worse quite quickly. So more needs to be done, much more needs to be done if we are to see safer custody in our prisons. I'll stop there. Thank you.
Thank you very much, Andrew, for that assessment of the stats. We're now going to hear from Tim, who works with our prison members.
Thank you. Yeah, very shocking statistics as always. I think, as Andrew said, some positives in that some of the figures are going down, and that's to be welcomed. But obviously, they are on a background of high incidence of violence and self-harm and assaults. Most of the trend lines over the last 5 years since COVID really have all been going up. And so it's still a system in some distress. And of course, these statistics are an average over the entire prison estate. And we know anyone that's been to prison has family and friends in prison knows that individual prisons vary widely in their sort of performance and rates of violence and self-harm. And that's really where our membership come in, and they can tell us how things are in their individual prison to cut through some of the official statistics that are kind of averaged out. I think to pick up on the rise in homicides, I think that's something that's really cut through to a lot of our members. It's kind of quite shocking to people in prison that these attacks are happening. Obviously, I think those are still ongoing court cases, so we won't discuss them too much. But we have lots of members that are in for sexual offences, and most of the recent high-profile homicides are on people with that kind of sentence, and so that's put a lot of fear in people serving those sentences. And as Andrea touched on, a lot of people are kind of isolating themselves to their cell on the back of sort of big homicide cases like that. One stat was mentioned that rates of assaults on staff have decreased, which is very good. We have a graph up on screen. I think, again, most people will know that prisons are run by staff. I guess that's kind of obvious to say, but not all staff are kind of created equal. And based off the back of a parliamentary question, the MOJ released data on the amount of cumulative experience they have within their staff. And so the top graph shows in kind of the early to mid noughties, there was a kind of reduction in staff numbers, I assume through some austerity measure. So prison officers left their post and took with them a lot of experience. And so whilst I guess successive governments have attempted to plug that hole and refill the well of staff numbers, the actual experience per officer in the bottom graph has declined from what was about 14 or 15 years per officer down to below 10 years on average per officer. It's those really experienced staff members that make the difference to your prison experience. They tend to be the ones that can see whether a situation is going to explode and turn volatile and lead to the assaults that make up these statistics in kind of the short term. But then longer term, a good quality staff body produce a more settled regime, which enables more rehabilitative activities and will reduce things like self-harm incidents, which are often a reflection of the poor prison environment and poor regime. I think that's all I'll say at the moment on that, and I think we're going to invite questions now.
Just to say, Tim, if we could just go back to that slide. Just to say that when I said earlier that prisons have for over a decade struggled with safety and custody, you can see it. Interestingly, there is a parallel there in the figures, because it was the kind of austerity cuts that took place over 2012, 2013. It was after that we started to see these quarterly figures going up and up and up. Now, over the years since, there has been some variation in that, most notably during COVID, when prisons were in lockdown and we didn't see as much violence, for example. We also actually saw drops in self-harm at first. But the overall trend of safety and custody, and a sense that prisons have not been on top of this issue, that has been the case more or less since 2013. And when you look at those graphs, interestingly, there is some parallel there in the drop of the numbers of people working in prison and now also their experience, which I think is another reason just to emphasize why I think that graph is useful context alongside the kind of prison population.
A couple of years ago, I was speaking at an event with Nick Hardwick, who's on our council, and he had a graph that was numbers of staff, and then rising assaults, and it appeared to be a pretty direct correlation between the two, which is pretty awful. Andrew, can I ask about assaults in prison? Do we know who's involved in them?
Yeah, sure. Sorry, give me a second. Sorry, I've got something on screen I'm just trying to find. Yeah, so in terms of who is involved assaults, in terms of age, people aged 18 to 20, so young adults in the system, they have the highest rates of involvement in assaults. Interestingly, people on remand had higher rates of involvement compared to sentenced people, which I was actually a little bit surprised at, although I suspect that that is because the involvement can cover being an assailant, being a fighter, as they term it, or being a victim. I do wonder whether people on remand are particularly vulnerable in the sense of being victims there. In the sentenced population, I mean, I mentioned recall being the increase in the recalled population being an issue in terms of these statistics. It is here too. In the sentenced population, rates of involvement in assaults are highest for recalled prisoners, although they are still lower than those for people on remand. So there are some interesting kind of differences there in terms of why you're in prison and then the likelihood that you might be involved in assaults.
And the stats also capture sexual assault. What do we know about that from?
Yeah, so this is really interesting because there were 617 sexual assaults in 2025, and that's a 21% increase and the highest number that they've got recorded. The rate also increased. I think, again, concerning, we've painted quite a concerning picture about what's going on in women's prisons. In women's prisons, sexual assaults increased by 60%, which compared to a 15% increase in male establishments. Now, the one caveat I'd put on that is that the Howard League has done some work on looking at sexual assaults in prison in the past, and one thing we'd say is that there has always been a challenge in the reporting and recording of sexual assaults in prison for, I think, understandable reasons. And it is possible that this rise in the figures that we're seeing here is partly due to better reporting and recording, rather than that actually prisons are becoming more dangerous in terms of sexual assaults. It is unclear, and interestingly, the statistician who puts together these figures doesn't make any kind of remark on this in the comment that they provide to the stats. But it's something that I think perhaps we might want to probe with the Ministry of Justice going forward.
Great, thank you. I think we'll open the floor to questions. If you have a question, please put it into the, sorry, my dog's barking, into the Q&A box and rather than in the chat box. I see that there's, sorry, Hugo. Sorry, absolute disaster. I see, first of all, I'm going to answer Roderick's question because I have checked Roderick's question with our researcher, Helen, who's offline, which is, has any research been done or commissioned into the reason why ethnically white prisoners are significantly more likely to self-harm than Black, Asian or foreign national prisoners? There is no specific research into this topic as far as we're aware, and that would be important to be done. If anybody knows of anybody who's done that, then please do let us know. I mean, on the whole, we think there needs to be better prevalence data of things like mental health to understand trends and needs. And we know that HMIP have done some thematic reviews on wellbeing and experiences for people from Black, minority, ethnic backgrounds as well as women, but not looking, as far as we know, at self-harm with respect to white prisoners. But again, if anybody in the audience knows about work in that respect, then please do get in touch and we'll share your answer with Roderick. Sue Andrew has a question here about children in local authority care.
Yes, so this question is, are children in the criminal justice system treated differently if they're in care than children who are not? I mean, the simple answer is yes. particularly if you're a child in custody, around leaving custody. If you have a history of being in the care system, then you will have rights and entitlements when you leave custody that can form part of the resettlement package that you receive from your local authority when you are back in the community. And I know that our legal team often gives advice on this to children who ring in on our free and confidential advice line from custody or the staff that work with them, because it can make quite a big difference if you are on a leaving care package, in terms of the support that you might then get both towards the end of your time in custody and then once you're actually back in the community.
Thank you. Tim, perhaps a question for you, which is from Tomika, which is about the investment in prisons in mental health. What is there to support mental health in prisons for people?
So it's a mandatory function within any prison. They have to provide healthcare, and they further have to provide mental health services. In addition to that, there'll be sort of drug and alcohol addiction services, given the sort of cohort and the many issues that people have going into prison. Things like addiction are quite high, and so there are specialist addiction services delivered in prison. Likewise, the prevalence of mental health issues is enormously high within prison. I think 3/4 of women within prison have a mental health condition, and about half of men have a mental health condition. So it's a population with enormous psychiatric need, often unmet. So whilst care is provided, there are many barriers in place that prevent people from accessing the appropriate care. There are, frankly, not enough psychiatrists and doctors and mental health care nurses within prisons. It's all well and good seeing a mental health practitioner in the appointment, but obviously it's then back to your cell, back to a bad regime. And so it's quite hard to implement any kind of, lifestyle and social changes that you would expect to receive on the out. And another troubling issue is kind of the lack of mental health hospital beds in the country. And so we often sadly see people kept in prison as, it sounds strange to say it, a place of safety, often in segregation units that are in, severe mental health distress. And because prisons are seen as like a safer place than perhaps the community, people languish in a prison rather than where they should be, which is a mental health bed. So certainly, more could be done to increase, mental health hospital places to meet this increasing need within prisons and give people at that kind of really extreme end of mental distress a better chance of recovery.
And what about the training of staff capacity to deal with people in mental distress? I should have mentioned before when I introduced Tim that Tim, before his running with the law and trip to prison, Tim was a medical doctor, so has a particular interest in these kind of issues. But in terms of staff capacity and training and those sort of things.
In terms of healthcare staff or prison staff?
Yeah, prison staff.
Well, I suppose it would, ideally, and I think there's another question about what training or how minimal training prison staff
Generally,
receive. In any other kind of state-run profession where there's a duty of care, like nursing, like teaching, whatever, there's usually a number of years of training to a reasonably high standard. And that's the kind of benchmark entry level for your staff member with the duty of care. And then obviously they will build on that experience that you can only get through the job. Whereas I think for a prison officer, it's in the weeks, the amount of training, 12 weeks. So it's quite a stark sort of, difference in the amount of training into quite a secretive and quite sort of unknown environment. We're not able to see prisons day to day. So it's, often these staff experience quite sort of an unknown shock when they first arrive, and often they feel quite unprepared. There's quite a high level of staff turnover for that reason, of staff entering and leaving the profession within a year or within 2 years. So there is, I believe, and it might be better to get input from someone within the prison services. I believe there is now some, within that 12 weeks, there is some training on what trauma is, why a prisoner acting violently might be, instead, that's an expression of suffered trauma. Trauma-informed approaches are becoming more built into training, I think. So there is, I think, the beginnings of what they call trauma-informed approaches within the training of prison staff. That's more mainstream within healthcare staff. But often your interaction in prison is first through the prison staff. They're your intermediary before you get to access healthcare. So it should, and I would hope they develop. It should always start with the prison officer. That's the kind of first port of call, and that's where you can make the biggest changes, I think.
Andrew, thoughts on staffing? Got a number of questions from David and Roderick and other people on staffing issues.
Yeah, no, I noticed the comment on Norway, and I've been to Norway a couple of times to see their prison system in action, and I mean, it's completely different. It's a much smaller prison population, which helps, but the staff receive considerably more training. There is a postgraduate degree. There's a degree in being a prison officer. It's 3 years. It's a combination of academic learning and then a year or perhaps more now. It's been a while since I've been there, but there was certainly at least a year of then being placed in a prison as part of your learning in that degree for kind of practical experience. Compared to 12 weeks, that is quite stark. And I do think that prisons in Norway are definitely safer and more ordered and generally more driven around rehabilitation than prisons here. But as I say, they don't have the same population pressures. They didn't see the sorts of staff cuts that we were discussing earlier, and then a need to try and recruit to get numbers back up, but you missing then on the experience that of the staff that you've lost. So it is a different context, but it's certainly a salutary one in terms of how things could be different.
Yeah, I mean, I've certainly been to a few prisons recently where I've talked to staff, and one of them were picked up at the train station by a driver, and talking to this woman, she had been a prison officer at the prison and just said that she didn't feel like she had sufficient training. Like she felt like she was out of her depth, and it was stressful. And she was there at nights effectively felt like she was by herself a lot of the time on a wing. And it was too much for her. And I can see a number of comments in the chat around lack of experience and youth in staff compliments, which I think is undoubtedly the case. And we do receive also letters from people in prison saying, I'm being looked after by a bunch of kids who don't know the first thing about being in jail. And these are sometimes men who've been in prison for decades, being looked after by people who are really very inexperienced, and they're having to tell the staff what to do to keep them safe, which seems a little the wrong way around. We've got so many questions. All of a sudden, questions all come in. I'm going to answer June's question though, because I think which Roderick has kindly put into the chat. Unfortunately, we have June and Tanya with us who've lost sons in prison to suicide. I'm so sorry that this is so raw and acute for you, and that your children would have been let down, your family's let down by the system. The question relates to what degree does the Prison Reform Trust and Inquest liaise with us? Very closely. I was talking to the Chief Executive of the Prison Reform Trust this morning about some of these sort of issues, and Inquest we also work with very closely. Until recently, we've served on the Ministerial Board on Deaths in Custody, which Lord Timpson has now decided will only involve ministers and senior civil servants, and not people like me or the PRT or Inquest, unless we're invited, or even the Ombudsman, unless invited. So that seems like a disappointing retreat from scrutiny from the Ministerial Board on Deaths in Custody. But we work closely with Inquest. We are working, as you might have seen, on issues of fire safety, and obviously there have been a number of recent inquests in respect to fire safety. Again, last week we put the family of the boy in, friends of the boy who died in Feltham, in touch with Inquest. So we do work with them closely, and obviously Inquest are experts in that process that unfortunately you have gone through. Other questions in here. Julie's asked a question around the women's estate and assault rates, Andrew.
Yeah, I'll read it out. The assault stats relating to women are startling. Rates are rather higher amongst girls, and young adult women. Remand rates are higher amongst these groups, which is very relevant, as is past trauma abuse. But there are serious questions to be asked about how staff, including male staff in the women's estate, are dealing with and perhaps also recording assault by women, and what the precursors of assault are. I'm also thinking about assaults on emergency workers in the community and possible parallels here. So I think I can't comment on the staffing question because I've not been in a women's prison for a while to observe staff. And frankly, if an assault is taking place, it usually is, we are kind of kept away from it. But I do think there's something to this question stroke comment, in the sense that it's very interesting to see the high propensity for self-harm amongst women in custody, and looking at that alongside this seeming rise in assaults, and I think linking it to thinking about assaults on emergency workers in the community, I think there is something in that. And by that, what I mean is that we are all, I think, quite concerned that the sort of drive to have mandatory custodial sentences around assaults on emergency workers is disproportionately, for example, brought women into the system, women who have been victims of mental distress, have had some moment of mental distress, have lashed out at emergency workers who have been intervening, and have then found themselves going through court and going into custody. And given that is a concern, that that's the sort of circumstance which is happening all too often, it is then not a huge stretch to then think that that mental distress then just carries on into custody, and that some of the symptoms of that distress will be both self-harm, but also potentially further incidents of violence involving other people.
Thank you. I mean, obviously, the remand, the point that so many of these women are on remand is why, as Andrew said, we're involved in the End Remand Collective with Women in Prison, Hibiscus Initiatives, and Clean Break, and a load of other women's organisations, which is work being driven by a group of women who've been on remand at its centre in terms of the governance in the elaboration of everything. And it's so important, just because women on remand are unsafe, along with all the other problems that they have, and the fact that they're not yet sentenced or convicted, and most of them will get non-custodial sentences or will be acquitted. It's just a pure injustice and a waste of public money and creation of ever more harm, which is why it's so important to us. Other questions in here. Sue's asked a question about, are all children, young adults over 16 sent to Feltham, Warrington or Wetherby? No. They are not. Some children can stay in secure children's homes until they're 18, or go to the STC. When it reopens, could go to the secure school. I don't know that we yet have a date for the reopening of the secure school. And of course, there is Park up in Wales, which is the only one of the YOIs that I could for a second imagine allowing my son to be in. Not that I get to allow, but like the only one I could conceive of my son being safe in, and probably not even there. So that's answered that question. More of these questions. So many questions here. Lots of questions about inquest and inquests. Andrew, I'm not sure if you have thoughts on some of these future death reports. Do they have a significant impact?
Yeah, I mean, certainly I think they have an impact in the system. And we are, as Andrea said, up until very, very recently, we were members of the Ministerial Board on Deaths in Custody. And part of that board's remit is to consider these reports and look at what the PPO is saying, and we're part of that conversation. But as Andrea said, at the moment, it looks like we're going to be excluded, at least regularly, from that board going forward, which is pretty concerning.
I think often the inquest reports and prevention of future death reports, they will suggest things that are very difficult for the prison to change in sort of the short term, just through the nature of the design of prisons. So things like cell bells often lead to delays in receiving healthcare, as in you're in your cell, you have chest pain, you press the bell, and then you're waiting for an officer to come. The bell might get turned off, etc., and you miss out on healthcare treatment. But you'd have to totally redesign the entire prison architecture in order to put any of those changes in place. So without being bold and really doing something different, a lot of those recommendations will just remain recommendations and sort of not really able to be actioned.
Yeah, I think the other thing I'd say is that actually, I think the emphasis, at least for the Howard League, should really be on preventing deaths happening in the first place. I mean, it is very much inquest's role to look at what happens when someone does sadly die, but it's why I kept talking about the prison population as a whole, and we talked about the kind of staffing situation. Because ultimately, if we're going to see deaths prevented, these are the issues that need to be addressed. The process in terms of PPO investigations or inquests is too late. And I remember, I mean, I've been at the Howard League for a very long time. I joined in 2007. And at that point in time, there was a sort of spike, for example, that was just taking place in self-inflicted deaths. And then there was a concerted effort by the prison service to refresh and push out its policies and training around safer custody. And we saw the numbers really drop. And it was only, as I say, once we saw the kind of austerity cuts, so 2012, 2013, a lot of experienced prison officers and a lot of prison officers generally leaving the profession, that the numbers then started to go up again. And I think that just emphasizes the extent to which you need these fundamentals around how many people are actually in the system and the experience and numbers of people working there to help them. You need to get those fundamentals right to prevent deaths happening in the first place.
Okay, relatedly, June asks about whether we support inquest's call for a national oversight mechanism. The answer to that is yes. Duty of candour, we're all for a duty of candour. When I was at Justice, we did a big report on MOJ should be made bound by a duty of candour. But that is again something we support. A question here about foreign nationals and the needs of foreign nationals. We have a lot of foreign nationals in our membership. I think because often our membership people reach out to us when they don't have anybody else they can easily get support from. Tim, is that right? And I think there is more that we as an organisation would like to do if we had more funding with respect to foreign nationals, because as Diane says, they don't have great outcomes. And I think they're very alone. They don't have advocates. They often have struggle with mental health, as well as language and all other kinds of problems that come when you're not from this country. I don't know, Tim, if you have any other thoughts.
Yeah, as you say, that sort of almost by definition, you'll be incredibly isolated, unable to engage with other prisoners and staff because you don't speak the language. And whilst there are attempts to bring translation services in, it tends not to happen. And I mean, I think anyone in prison will get bound up in process and bureaucracy, and there'll be some issue with the sentence, and things like trying to orchestrate a move to another prison to be closer to your family are hard enough, and then trying to do it in a second language with all the restrictions that type of sentence, being a foreign national, has. And yeah, if you're awaiting something like a deportation, it's uncertainty. I guess it correlates a bit with people on remand having higher levels of self-harm incidents. It's the uncertainty that drives people to do that. And I think often once you have your sentence, then you can plan and get on with it, and you'll be released. But waiting to be deported and your sentence sort of being up in the air, how long you'll serve, what will happen when you return to your home country, and how you'll be received there as well. All just adds to a general picture of the stress without the ability to speak to anyone about it.
Yeah, I mean, I have to say, when I visit prisons, often meeting foreign nationals, all they want to happen is to be deported. Like, they just want to go home so they can be near loved ones. And occasionally they talk about how their loved ones are now in this country, but often they just want to go back home. There's a question here from Becca about levels of experience of prison officers and accessing more, I guess, granular information on experience of levels of responsibility. I'm not sure if we have that information. Andrew shaking his head. We don't. But I agree that it would be good to have that information, and it might be something that we try to get a bit more FOI or ask some PQs to get that, because I mean, you're absolutely right that it's not just about numbers of officers, it's where they are and what experiences they have. Elora's asked a question about toughing and prison staff under pressure. I'm not sure if either of our panelists have thoughts on that.
I mean, there's no doubt. I mean, it's a kind of concomitant point to the point we were saying about prison officer training, in that I don't think staff get anything like the level of support and potentially access to things like counselling that they should be getting, given the nature of the work. There was an initiative that was running in prisons for many years, Unlocked Graduates, which saw graduates taking on prison officer roles, and there was some controversy around that particular scheme. But I think one of the simplest things that they were doing for those graduates in the first year that they were working was they were offering an opportunity for, they were working in various prisons in an area, and they were all of the kind of same graduate cohort. They could meet. I can't remember whether it was a fortnight or once a month, but they could meet as a group to just share their experiences of what it was like to have started working in the prison that they were in, and kind of almost brainstorm the problems that they were facing, and just get some of it off their chest. Well, I mean, that was available because this charity, Unlock Graduates, was offering that. It wasn't part of the prison services standard kind of care and support for staff. And it seems to me a pretty basic thing, particularly for someone new to the service, that they should be getting. But a lot of it, unfortunately, relies much more on informal supportive relationships. Again, interestingly, where it's important if you have more experienced staff, because they can offer that kind of mentorship and support. And if they're not there, then who are you going to get that kind of advice and help?
And the risk is more sick leave, and then that further destabilizes the regime as more staff are off somewhat unpredictably.
Yeah, I mean, it's you often see prisons with high levels of staff sick. I mean, that just is a real canary in the coal mine of an unwell prison, I think, because it has so many implications across the piece. Thank you. Roderick's asked a question here about saying some acts of self-harm are a decision not to harm somebody else. Are there any statistics on this, or is it ignored? Should self-harm be qualified as a positive balance against a positive assault? I mean, I have to say,
yeah, I mean, we can't. The motivations behind self-harm are not recorded as part of the self-harm incident. I'm not sure myself that the majority of self-harm it happens for those reasons. I see Roderick's got another question which I can answer.
yes.
Which is about the prison population. He says, given the prison population is not stable, are the increases and decreases in real terms, i.e., proportional to any increase or decrease therein? So I think what the question is saying is, what can we tell about the way the prison population is going compared to how these statistics and the trends that they have? This is actually addressed partly in the bulletin. So the prison population does vary, and I talked about it varying. But broadly speaking, there are some trends, and the total prison population, broadly speaking, remains steady in the latest year, but that was following a large increase in the prison population since 2021, particularly as the bulletin says, for certain population groups like people on remand. So as at the 31st of March 2026, the prison population was around 600 lower than at the end of March 2025. The prison population as of the 31st of March 2026 was around 9,500, or 12% higher than it was at the end of April 2021. With the male prison population increasing by 12% and the female prison population increasing by 10%. Now, and over that period, we have broadly seen increases in these issues. And it's one of the ways in which these statistics try and capture this change in the population is by looking at rates of incidents of assaults or self-harm, whatever it might be, rates per 1,000 prisoners, rather than the raw number of incidents, because that is meant to try and more accurately describe the trends within these kind of changing population numbers.
And
Thank you.
The women's figures will always be more volatile because there are fewer women. I think there's 3,000 women in prison. So per 1,000, the rate will always be a bit more volatile on each statistical release, whereas the male prison population being a larger number will be less volatile.
And Tanya's asked a very personal question here about her son's experience. I mean, I think you really need to talk, Tanya, I'm sure you have, to Inquest and see if they can give you help. I have a friend whose brother died at the Mount. He also killed himself, and to this day they haven't been able to recover his things, and that happened nearly 10 years ago. So that there is a prison with form for poor treatment of families. Let's see, Olivia's asked a question here. Tim, Andrew, if you might have a look at it, about how current safety systems like ACTS currently work.
I mean, ACT was one of the things that was introduced. I was talking earlier about a rise in deaths, and when I started at the Howard League almost 20 years ago, and then a concerted effort at driving the numbers down, and a revision of ACT at the time was part of the response to bringing the numbers of deaths down. I think on paper, ACT can work. I think the issue, as we've talked about, is does it work when you have grossly overcrowded prisons? You don't have enough staff, you don't have enough experienced staff. They know what they are meant to do on paper, but are they able to do it in practice? And as I said earlier, I just think that you need to get those fundamentals right to get the kind of preventative practice, both already established practice like ACT, but also, better mental health screening early on. There is some, I think, from institution to institution, there have been some improvements around reception practices. But the challenge is always what can be managed when the overriding priority every day is just, can we manage the number of people that we have in our prison? And do we have the staff to do it?
Tim?
Yeah, I think something like ACT is, yeah, as Andrew said, a good idea. It's a national guideline. There are clear procedures to follow. It ensures that people in mental distress are being, more intently supervised by staff. But obviously, then that then is an enormous burden on the staff to do. And if you have many, many, many people all requiring an ACT, the process kind of falls apart and then isn't being delivered as it should be. So any national guideline like that does, again, need to be backed up by the resources to implement it. And indeed, I think the earlier parts of the question is whether it's better to ensure mental health needs are identified early on. Absolutely. I mean, from people arrive in a prison somewhat often unexpectedly if they're remanded. You can turn up to a prison on a Friday night. There might be limited healthcare staff there or staff in general. So often, I mean, it's something that happened to me and something that still happens. Your medication won't be prescribed that Friday evening, and you'll probably miss out for the weekend. And if you're on psychiatric medications, you're in this like stressful new environment, remanded potentially. We know that's a really sort of dangerous period, and then you're depriving people of their usual mental health medication. It's kind of a recipe for disaster. So again, that's somewhere where guidelines and procedures could be put in place, but to date, it's done in some prisons, but not all prisons.
Yeah. I see a surprise from a number of people about the ministerial board. Yeah, we're surprised too. We are not pleased and will be responding because this is a cross-departmental board of Health, Home Office and prisons that was meeting with civil society, the Samaritans, RCPOT, the Chief Inspector of Prisons, the Prisons Ombudsman, and others, as well as ministers and senior civil servants. And we've been told that that's now being rationalised and we'll be invited on a need to be invited basis, which is just feels like a diminution of scrutiny to us. So we will be formally responding, and also worrying given kind of news about potential mergers of HMIP, the lay observers, and IMBs. These are bodies that are really important to be eyes and ears on what's happening behind closed doors. And it's worrying when there are any efforts or sort of proposals to limit the power and independence potentially of those bodies. So we await that space. We have no more questions and we've come to the end of our time. I would like to thank our two speakers, Andrew and Tim, for giving up their time. Tim is actually on holiday today and abroad. So particular thanks to Tim for joining us. Today's data confirms that prisons aren't places of safety. They're not places of recovery or rehabilitation. I speak on a lot of talkback radio and people are always calling in saying, we need to, you have these places, they need to rehabilitate people. As Andrew's made really clear, the conditions in prisons don't give the latitude to rehabilitate people. But at the moment, they're struggling even to meet the most basic needs of safety and care. And that speaks not just to the conditions in the prison estate and who's staffing them and all of those levels, but to choices that are being made about who gets criminalised, how long people spend in prison, and what we really expect from our prison system. And these are big questions that government needs to grapple with if things are going to improve. It's not enough just to build more failing prisons where they can't, get staff or keep the prisons they've got safe. already, and we appreciate that. That's why you support the Howard League, and we're grateful for that support. If you're not yet a member, please do join us. My condolences and love to those people for whom this has been a very personal spotlight. This is a dangerous prison system, and I'm sorry that your families have been on the awful end of that. We will continue to do all we can to try to make prisons more decent and safe. I look forward to seeing you at a Spotlight event sometime soon, and I wish you a very happy, sunny afternoon. Goodbye.
Goodbye.
Thank you, everyone. Bye.